sir, can you please introduce yourself?
Absolutely. I'm Dr. Vahik Meserkhani. I'm a prosthodontist, implantologist trained in Loma Linda University. I've been practicing implantology and prosthodontics in Southern California.
First of all, sir, thank you very much for taking part in the first International SGS Dental Congress as the speaker. We really appreciate it.
It was my pleasure to be here.
What do you think is the biggest advantage of using the SGS dental system?
Well, basically, as an implant surgeon, the ease of use, the surface characteristics of SGS implant is very friendly to soft tissue and hard tissue. And the prosthodontic component as a prosthodontist is very easy to use. So it's user-friendly. The lab has no problem whatsoever.
And do you have your favorite product in the SGS dental line? If you have one, so can you explain why, please?
Absolutely. Well, I started with P7, which used to be very good, but the P5 that I use is my favorite. Multiple reasons. One reason is that it's a conical connection. The second reason is because screw loosening is not happening. There is proper platform switching on P5, which makes me comfortable as a person. And at the end, when we are restoring different type of restoration, from traditional restoration all the way to tilted implant technique, I feel very comfortable with the abutments and with the components.
What comes first into your mind when you hear SGS dental?
Well, two important things: ease of use and predictability of the implant itself. So when I think about, to me, SGS at this point, especially P5, which I use it on a regular basis, it's a modern implant to use.
Okay, and the last question, sir. Just few words to your colleagues all around the world.
Well, if you're looking for an implant which has all the characteristics of today's implant, I'll tell you the surface is ideal, the connection is really good. In my part, obviously, is the P5. So I'm specifically using P5, but I used P7 in the past. It's a very predictable implant, but the ease of use, it's called a modern implant. It's an implant for everyday use, and you could use it in static zone, you could use it in posterior area, overdenture, fixed prosthesis. So as an application, very much for everything.
Mr. Meserkhani, thank you very much.
Absolutely, my pleasure.